So any question that you have, please feel free to ask them through our numbers 0721 105 105 23814. Our SMS code, which is absolutely free. But of course, we're live on Facebook, on MBCI TV Facebook page. We're live on YouTube, on MBCI TV official YouTube page. But for a start, let us get to know who exactly Dr. Jemima is.
Dr. Kariuki is currently a registrar in obstetrics and gynecology, diligently pursuing her specialist recognition. Her commitment in enhancing maternal health care is exemplified through her role as the founder and CEO of Wheels for Life, an innovative organization dedicated to reducing pregnancy-related complications by addressing the critical delays in accessing maternal health care services. Through her tireless efforts, she is making strides in connecting communities to essential health care facilities. Her impactful work has garnered both local and international acclaim, and in 2020 she was recognized by the BBC as one of their 100 women, and in 2021 she was featured in Tropicals magazine's list of influential figures. Dr. Kariuki has also been honored as one of the top 500 most influential Africans, recognized in Avance's 100 most influential Africans. Additionally, she received the prestigious Uzalendo Presidential Award in 2020 and the WHO Director General Award for her outstanding contributions to maternal health. Ladies and gentlemen, please join me in welcoming Dr. Jemima Kariuki, a true champion for mothers and visionary in healthcare innovation.
Perfecto. Now that is exactly who Dr. Jemima is. And of course, this is not the first time we're having her here. The other time tulikuwa hapa tukiongelea about your reproductive health. Okay? And we talked so much about that. Na mkasema now this time you want us to talk about pregnancy and infertility. And she has done that for a very long time through Wheels for Life. Yes. And today she's going to be tackling this particular topic. Karibu sana.
Thank you so much.
We're very glad to have you today.
Asanteni.
Again.
Great.
Yeah. So as we start, please tell us about Wheels for Life.
So Wheels for Life is an organization that focuses on helping women by teaching them, by educating them, by empowering them, and by treating them so that they have wholesome health. One, because they're the caregivers. Two, because if you teach and empower a woman, really you've helped the whole community. Yeah, so that's what we do. We offer free transport to hospital in case of delivery or emergency during pregnancy. We have webinars every week to work with women in terms of what they're working on. So we have a financial segment, we have a health segment, we have a WhatsApp community that is growing to again work day by day, because sometimes something happens at home and you want a quick answer. We have a Wheels for Life app in case you actually want a telehealth consultation. So Wheels for Life is a movement for women, by women.
Love it. Now, you've touched on pregnancies, and that is exactly what we'll be talking about today.
Yes.
And then combined with infertility, but we'll be starting with pregnancies. Yeah. So this is the most asked questions by ladies who are looking forward to get babies or to get pregnant, and they keep asking, how early should I start the prenatal care?
Before you conceive. Before you conceive, about 3 months prior is when we actually guide women to come to hospital. One, because we need to do baseline tests and find out, are there any issues that could interfere with the pregnancy? Two, we need to also up your body, because during pregnancy it utilizes a lot of the nutrients, minerals that are stored in the body. So we kind of have to increase what already you have. We also have to tackle what diet you need to have for you to get pregnant, what medication not to have if you want to get pregnant. Of course, stop alcohol and smoking. So such things. And it's not just for the wife, by the way, or the mother. It's also for the partner.
All right.
Yeah, because semen is alive for 90 days. So if you were to get pregnant today, that sperm was born 90 days ago. So 3 months prior is when we also want to meet the gentleman as well.
And what are some of these issues that would affect the pregnancy? Because you've said one of the reasons why we need to come to hospital or for the prenatal care 3 months prior is that there are some of the conditions that would affect the pregnancy.
Yes.
What are some of these conditions?
One of them is thyroid. If you have hyperthyroidism, which means like goiter, most people know it as goiter.
Yeah.
So if you have goiter, it adversely affects the pregnancy. In fact, it's a cause of miscarriage.
How is that related?
Very related. The thyroid is like a metabolic body. It's the one that gives energy. So for the baby to be born, a lot of energy is required, which will come from the thyroid. In fact, in pregnancy, some women get goiter, and it's because the body and that of the baby is consuming a lot. So if there's a mismatch, it can cause a miscarriage. Yeah. And then we have diabetes. Diabetes is one of the leading causes of miscarriages. It's also one of the leading causes of congenital malformations. So if the sugars are too high, the baby can grow with some defects. So we want to control the sugars before we go into getting pregnant. And of course, hypertension. Yeah.
All right. People talk about vitamins and supplements that you're supposed to take during pregnancy. Is that important? And which are these vitamins and supplements?
I think all of them. All of them are important, but the main one is folic acid. And folic acid needs to be at least 400 micrograms every single day from 3 months before you conceive.
A lot of work.
And especially in the first trimester. Because folic acid is what is used to grow the brain, is what is used to develop the spine and the back area. And all that develops before 8 weeks. So you see why you needed the folic slightly earlier. So if you start your clinic at 20 weeks, we'll give you the folic, but it will not be to help the rest of the cells grow. But the main thing it would have prevented should have started in first trimester.
Earlier or before the first trimester?
Yes.
Okay. Is it safe to exercise during pregnancy?
Very safe. But,
but I knew there was a but somewhere.
If you are gymming before you are lifting weights and stuff like that, you can continue. Okay. But if you are not gymming and then you get pregnant and start lifting weights, that shift for your body may be a bit too much. Okay. So walking is exercise, swimming is exercise, running, but not high impact running is also allowed. But again, based on how swimming and walking you can start, but running, lifting weights, ideally if you are not doing it before, do it after. Yes.
All right.
Yes.
Are there foods that one should avoid during pregnancy?
It depends on when in the pregnancy. Yeah. Mercury containing foods are not safe, so we call things like seafood, raw seafood, ideally should be avoided. But salmon is very good for someone who's pregnant. So things like pineapples and papaya, we tend to say avoid them in first trimester because they have some enzymes that can cause contractions. Those minor contractions may not be so much, but if you're prone to a miscarriage, it can cause a miscarriage. In the third trimester, eat whatever you want.
All right. Now that brings me to the first, second, and the third trimester. What's the journey like?
I love this question. I have a course on this question. The first, second, and third trimester are very different. The first trimester typically is before the mom knows she's even pregnant, all the way till 12, 13 weeks, depending on which book you're reading. But let's say 13 weeks. So in that first trimester is when the baby cells are organizing and becoming like you. So you start from being an egg to being something that looks like a tadpole to being something all the way and to looking like a human being. So that happens in the first 13 weeks. So at that stage, you need so much in terms of minerals, in terms of energy, because it's a new baby developing. So you'll find the mommy is tired, exhausted all the time, they're nauseous because of high surge of hormones. Typically, it's just it's a time. Okay, but there's some people who will not have nausea, but they'll be extremely sleepy. There are those ones who will really puke, but then after that they go to work. It depends on really how your body takes it. And each pregnancy is different. So first pregnancy may have been, then this second baby, you're like, what's going on? Okay, and also how healthy was a mom before that pregnancy. So second trimester is a bliss. Barely remember you're pregnant. Your baby starts moving, so you're starting to talk to your baby. It's just an amazing time. If you're glowing, no stress in life. The third
so that's
trimester,
from 14 weeks
14 to 27.
27.
They're about 28. Let's call it 28. Then you go to the third trimester. So from 29 till delivery. Add that from 28 till delivery, according to ARCOG. Yes. So from that time, during the first days of third trimester, you're good. And then now baby becomes big. So you start getting backaches and cramps and pressure symptoms. One leg is having a muscle cramp. The other leg, you can't sleep on this side. You don't want this side. Sleep disappears. Okay, so all that is because the hormones are again shifting as you near delivery. 1, 2, the baby is just big. So even breathing becomes difficult. You walk a short distance. Everyone can tell this one is gravid. Then you also get tired, but this fatigue is not hormonal based. It's just that you're carrying a lot. By this time, you've added about 10 kilos. 6 of those belong to the baby, either from the kilos of the baby, the fluid of the baby, the placenta of the baby. So your center of gravity has changed. You're waddling, you're walking like this, and then you deliver. And then you enter the fourth trimester.
The fourth trimester?
Yes.
Which is?
Between delivery and 12 weeks.
Okay.
So the fourth trimester is really important, and most people forget it. Because you have a new mom trying to figure out a new baby. There's that breastfeeding journey. You have postpartum issues, depression, anxiety, hypertension, diabetes, depending. So all that also needs to be taken care of, but more so is mental support of the mother and emotional support of the mother, and having caregivers also help with the baby.
Okay, wow, that's very important. Anyway, the fourth trimester, people rarely talk about it. Rarely talk about it, but that's very important, as you've mentioned. You've mentioned about postpartum. I'd want to ask at this point, what causes postpartum hemorrhage?
That's a good question. Postpartum hemorrhage is bleeding after delivery, and it could be, actually it's excessive bleeding after delivery. We expect a bit of bleeding, but not above 500 ml. So it can be caused by different things, maybe a tear during delivery, part of the placenta or things of conception remaining inside the uterus. Atony. Atony just means the uterus is not contracting as fast as it ought to contract, and that's actually the main reason for postpartum bleeding. And then you may be having some blood disorders that we did not know about until the point of delivery, and you're bleeding and we can't catch it. So those are the main ones.
All right. And how is it tackled?
Very fast, depending if we notice it, because there's postpartum bleeding that happens between the first 24 hours, 24 to 48 hours, and then there's that happens after 48 hours till 6 weeks. If that happens, it's probably because of an infection, and you need to go to hospital immediately, because we're not there with you. We'll not know it's happening. So if we notice that you're bleeding beyond 3 or 4 pads within the first hour, we know that something is not right, or you're having clots. We have a very good study done by Prof. Zahida Qureshi. It's called the emotive study. So in this study, we do a couple of interventions at the same time. So we give you certain medications, some IV, some under your tongue or in the parectal space. We start massaging your uterus. You'll see someone going in to remove any clots during that space of delivery. And then we put something called a tamponade, where we hang fluids to kind of hold the uterus. There's some where it's so bad we may have to go to theater and actually do a stitch from inside. So there are very many mechanisms based on how much are you bleeding and how fast are we able to stop it.
All right. You've mentioned about weight gain during pregnancy. What is the rates of, say, weight gain? Yeah.
10 to 15 kilos.
So anything below 10 is
It's
bad?
not abnormal. Depending again on where you read it, maybe 8 to 15. But if you look at it, if you are vomiting a lot in the first trimester, we're not shocked if you lose some kgs because you're not feeding well. In the second trimester, you gain from 3 to 5 kilos. In the third trimester, you gain for another 5, from 5 to 7 to 8 kilos. So you see, if I do that math, it will come to 8 to 15. Yes. So there are those who stagnate at a particular weight, but the baby is still growing. So we get concerned, is the mom okay? Or when we see everything else, every other parameter is okay, we are not very concerned. Our concern is if the baby is not growing, then now we know there's a problem.
Okay. Now, what are some of the signs of complications when one is pregnant?
Headache.
Headache.
Yeah, it's the commonest and the one that people assume. But if you have a headache, it could mean a persistent headache. It's not responding to paracetamol, or you have to keep taking paracetamol. Paracetamol is the only analgesic allowed. Okay.
Why?
Because others can cause contractions. Others go to the baby. So unless it's something that we as doctors are prescribed, please don't over the counter. Yes. So you're getting this headache, it's not responding to medication. Then we need to check, is your HB low? If your HB is low, that is anemia of pregnancy. Anemia of pregnancy is one of the causes of postpartum bleeding that you are asking about, because your body doesn't have enough red blood cells to begin with. So when you start bleeding, it just bleeds. Yes. Then headache can tell us you have hypertension of pregnancy. Headache can tell us you're having a bleed in your pregnancy. Headache can tell us you're bleeding, you're vomiting and having a lot of dehydration. Therefore, we need to figure out what's going on. Headache can tell us you have a toothache in pregnancy, and which can mean either you have an infection of your tooth or your calcium is getting depleted. So headache is something small but very big. Actually, there's someone who mentioned that while they were pregnant, they had a toothache, and they couldn't remove the tooth. I was like, it's just a tooth. How is it even related to the pregnancy? Mouth oral hygiene is very important. One, because sometimes those bacteria can go to the heart and cause an infection of the heart. Yeah, it's called rheumatic fever or rheumatic heart disease. So if you're having a toothache, you need to be seen by your gynae and the dentist. Yeah, you need to be seen by a dentist and let the dentist determine, is this tooth able to be filled for the meantime? Can we do antibiotics? And it has to be treated before it is removed. So it's the two of us, doctor, dentist to gynae, we discuss, this one is really bad, this one let's remove it and see, or this one we can give antibiotics until and see how it is, then now we can remove after the fact. Yeah.
Very interesting. But I see we're getting to, there's a question on labor. But before we get there, I'd want us to check some of the myth busters. What are some of the myths that are related to pregnancies and infertility? Now, for now, we'll be getting to check the ones that are related to pregnancies. And then later, we'll be getting into the infertility part. The third one, Nsema, you can trick your body into getting pregnant. Is that true?
What do you mean trick?
Actually, this one is someone who mentioned.
I don't know.
Yeah,
I don't know how you can trick your body into getting pregnant. I mean, pregnancy involves a man and a woman having sexual intercourse at a particular window of their fertility. So I don't know. I don't know how you trick it.
Yeah.
It's science.
Atatuambia. Asema, eating certain foods can guarantee pregnancy.
Oh.
Is that true?
That's a comme ça. One, because some foods are fertility foods, and therefore they're very good in terms of promoting the body health. Okay. But guarantee is a strong word. Yeah.
Okay. So not to guarantee, but it can
help.
Support.
It can support.
Okay.
Yes.
Okay.
Yes.
Now we get into the one asking about labor. So what are the options for relieving the labor pains?
Oh, so many. So many.
Let's start with, are you supposed to relieve the labor pains?
Yeah, why not?
During pregnancy?
No. So during delivery, during that time of delivery, we can reduce how much pain you're having.
But the pain is supposed to help in delivery.
No, contractions.
It's contraction of the pain.
No. The contractions are the uterus doing this to push the baby out, in and out, yeah?
Is that not
pain is how we perceive that contraction. Okay? So there are people who, you can, I wish I showed you that meme, but there are people who will do this. And it's done. But there are people who will be on their feet and it's really painful. But it's a perception of how are the contractions. So yes, it's painful, but even if we knock out the pain, remember pain is a signal. It's a signal from the uterus to the brain that something is happening here. Okay? So we can knock out the signal without stopping the contraction.
That's very interesting.
Yeah.
That's very interesting. Okay. Yeah. Because I had someone saying that, no, you shouldn't stop the pains. That is what's supposed to bring out the baby.
No, we stop the signal going to the brain. So for example, if I cut you here, and rather, let's say you got a cut, and then I give you painkiller, have you stopped bleeding?
No, but
the pain has gone. So I've just stopped the pathway telling your brain that there's something going on here.
Okay.
Yeah.
Very interesting. So how can you stop the pains?
Okay. One, we can give you painkillers that are centrally acting. So they block at the point of the brain so that you don't feel the pain. Two, we have something called epidural, where we go to your spine and we kind of interrupt the pathway between the down and up. So down you're contracting, up you relax. Yes, we call that epidural. That one we don't give too much, because if we give too much, we'll actually knock out the labor. So it's a labor we don't want to knock out. It's not the pain. You get the difference. So we can give you epidural. The problem of giving you epidural is that it prolongs the labor. So if you were to deliver in 6 hours, you'll deliver in 8 hours. So it prolongs it by 2 to 4 hours, depending. And now that one you have to be delivered by a very good team, because it's for us to perceive the contraction for you so that you can push. Yeah.
Wow. The other part is about the CS, cesarean section, because you've talked about, of course, with the labor pains, most of the people deliver normally, but there's the other part of CS. So what causes one to opt, or rather have a CS?
Cesarean section.
Yes, cesarean section instead of delivering normally.
If you've had someone has delivered by a cesarean section, there was a complication. A cesarean section is an operation we do because normal birth can't continue. So it's not something you opt into. It's a complication. So for example, the baby was too big, the baby has gotten tired, there's something off with the baby, or the baby has not developed enough for us to be able to put the baby under the pressure of delivery, because it's stress. Labor is actually stress for the mother and for the baby.
The baby as well?
Yes, because remember, it's the head getting squished out. Yes, so it's stress for both mother and baby. But that stress is what helps them to have that fast cry and breathe well. But there are babies we look at and we know that this one based on how they have grown in the womb, and based on some markers that we check the heart rate and what, and they've pooped or something like that. We know this one will not cope with labor, therefore we deliver them by a cesarean. So most of the factors are fetal, the baby, but sometimes mom is just too small. Okay, the hips are not big enough for the baby size. So you find that one will have to deliver normally, because whether we shine or rain, or we'll stay there for 48 hours and we'll still not have delivered, or we'll deliver a baby who is not structurally okay.
Okay. So prolonged labor would cause a baby to have complications?
Yes.
Like?
Yes. Something we call birth asphyxia, where the baby is born having not gotten enough oxygen in their brain, because every time there's a contraction, they don't get blood supply. When the contraction relaxes, then they get blood supply. So if that happens for so long, then it starts affecting their brain. So prolonged exposure to no oxygen in their brain causes now asphyxia, which is a type of mental retardation that was caused by the labor. So they developed okay, but during that process something went bad.
Okay. Wow. All right. The people who complain about stretch marks after delivery or during the pregnancy, and nimeona kuna mtu ameuliza, can that be avoided?
Ngumu, tricky kidogo. We can try and moisturize the skin so that it doesn't get too many stretch marks, but because the baby is growing from 0 to 3 kgs in 9 months, it will overstretch the skin. So, but continuous lubrication meaning like using coconut oil, using shea butter, you know, those natural oils can help with the skin. But whenever you're oiling your skin, it would have to be the tummy, the back, the thighs. Okay. So people just do the tongue, and yet the back will stretch, the thighs will stretch. Okay. Yeah. So it will not completely eliminate, but it will reduce kidogo.
Okay. I see we have someone asking, Doc, can you talk about transverse uterus in pregnancy? Can it cause challenges or delay in conceiving?
Yes.
I know that is
it's a congenital malformation.
Infertility?
Yes, it's okay, I can answer. It's a congenital malformation on how the uterus developed. Okay. The uterus develops as this and this, 2 organs, and they come and merge together. And then there's a septum in between that dissolves, so that it becomes one body, kind of like how the heart develops. Okay? So when that happens, when the development is not okay, that septum, that transverse septum, can cause one of 2 things. One, infertility, because the sperms are not able to go well up into the uterus and into the tubes. 2, it can cause, let's say, preterm labors and preterm deliveries, because the space to carry the baby is reduced because of this septum.
Okay. Yeah. Oh, right. Someone asking about what is the best sleeping position when you're pregnant, especially at
Trimester.
Yes.
Yes.
No, nyumbani they're overworking today. What? So during that trimester.
On your left.
On your left.
On your left.
Why
lie on your left, because it shifts the baby to the left, which dislodges the baby from lying on the inferior vena cava.
Okay.
So that if it lies on the inferior vena cava, it causes blood does not go up the heart correctly and can cause muscle cramps. So you want to relieve that pressure. Okay. Also, if you can sleep with pillows, so like you put a pillow between the baby and the bed, so that there's a pillow and one in between your legs. It also helps quite a bit. Okay. Not for anything scientific, it just helps you to shift around. Yes.
Okay, to get a bit comfortable with sleeping.
Yes.
Okay. And so hello. Kindly ask the doctor about hair loss during breastfeeding and how to deal with it.
Also, one that is common, by the way, that is common.
It's common?
Yes, very common.
Why?
Because as you're breastfeeding, you're also passing your nutrients on to the baby, but majorly because progesterone hormones goes down.
Okay.
And as it goes down, one of the things that it does is that when you're pregnant, your hair grows and you know, it just because there's a hormone that allows the skin cells and keratin of the hair and nails to really grow well. But after pregnancy, that hormone goes down. So as it goes down, its effects goes down. So that bountifulness that was there also goes down to almost normal. Then because you're breastfeeding, it also takes out a lot from the mother. So how to go about it is take supplements. Okay. Especially that have biotin.
All right. We'll be getting into the topic of infertility in a few minutes. But before that, what are the risks of gestational diabetes? So first tell us about it, what that is, and then how we can prevent it.
Okay. Gestational diabetes is diabetes that presents during pregnancy because of the pregnancy. So after pregnancy, it ideally goes away. But if you have gestational diabetes, you need to know that in your lifeline, you're predisposed to getting diabetes type 2. Okay? Because it's pregnancy is an insulin-resistant state, which means during pregnancy, your body by itself wants a lot of glucose to circulate for the sake of mom and baby. So how it does that is it makes the cell not respond to insulin. Okay. So insulin is what is supposed to tell sugar, go away, go away, go away. Yes. So ideally, even as that change happens, it should be enough to allow the normal sugar balances to continue. Okay. So what happens, the greatest problem of gestational diabetes is that if left unchecked, it can kill the baby. Okay. That's the greatest harm of gestational diabetes. And babies of diabetes mothers of gestational diabetes moms who are it's not being controlled, we deliver them earlier. We deliver them at around 37, 38 weeks. Okay. Why? Because they get sudden fetal death. They have high sugars, then the sugars drop for some reason, mom did not eat or whatever. Then the baby has no sugar. So they get into hypoglycemia, and hypoglycemia kills you like that. Okay? The other thing is the baby will be born, they will have respiratory issues because their lungs did not mature enough because of the presence of too much sugar. Okay? They can also be born with calcium issues. So the calcium is not, the balance of calcium is not that good. So mothers of gestational diabetes have to be delivered in hospital, have to be delivered where there's a pediatrician to receive the baby.
So you have to be really careful.
Yes. And how to know is the baby is too big.
Why too big?
Because if you have too much sugar, then it will be converted to fat, so you get a big baby. So if you get your pregnancy that the baby, the scan, baby was 3 point something, then 3.8, then 4 point, then 5, we get concerned.
Anasema hello, how can I manage morning sickness, please? This one is on her first trimester.
I can see. Please come see me. The home remedies are ginger. If you have ginger sweets, ginger tea, it really, really helps. Also citric foods, like oranges, lemons, they tend to remove that nausea. We have medication that we give, which is also very good at controlling it. Also, if you can get vitamin B, it's also very good at controlling it.
Okay. And the hi, kindly ask the doctor.
And take small meals.
Small meals.
Like don't eat to finish supper. Eat small bowls throughout the day.
Okay. But that should be the same for any pregnant mother?
Not really, they eat.
Quite a lot?
Yes.
All right, and I say, well, hi. Kindly ask Daktari. Okay, send your message. Thank you. And Eliza, kindly ask Daktari. after how long should I get pregnant after delivering through CS?
24 months.
24 months. Why 24 months?
The body heals well after 1 year.
Okay.
So after 1 year, in terms of the uterus, it should be okay. But we tend to give it another 6 months. Why we usually see 24 months is it allows you to breastfeed the first baby, to regain your body energy, to regain your body nutrients, you as the mom, so that as you're carrying the second pregnancy, you're up to it, like you're strong enough for it. Yeah.
Okay. Perfect. Now we need to get to the other part of infertility, but we'll be getting to answer your questions, so do not worry. But for now, I want us to get into some vox pops for us to just see what people out there think about pregnancies and infertility, because during the research, we realized that you have so many people, even ladies, that do not really understand the nitty-gritties about pregnancies and infertility. But for now, let's get to see what people are saying about the same.
Okay, in ladies, pengine ina depend na ovulation venye iko, ama labda venye nini yako. Kuna most of us wanatumia family planning, so unaweza kuta zingine ziko na hormones, inaweza develop hiyo, ama labda venye menstruation inaenda.
Yenye inakuaga ni ambapo kwa ile familia ambapo kuna mtu ameumbwa pande hiyo, kuna mahali kunakuwa kumetegemea kidogo, kuna mtu ako na makosa na familia kuna makosa anakuaga nayo. Sasa ndio ambapo inategemea bibi haizi pata mtoto.
Kwa mwanamke inategemea na venye huyu mtoto. Unajua kuna wale wenye wasichana wenye wanasahanga mapema, wanaanza kuzaa wakiwa kwa shule, wakitupa watoto, wanatupa watoto. Sasa kutupa watoto, Mungu anakujaga hasa saa zile zenye unataka anakufungia. Sababu wale wengine walitupa kwa choo, na sasa utakuwa sasa unatafuta nini? Mungu alikupea ukakata.
Pande ya mwanaume unaona pombe inafanya mtu hawezi zaa. Hiyo ni ukweli. Juu pale ile vitu zenye ukikunywa unasahau na ndo inakumaliza.
Kitu ya kwanza ni kukura hizi vitu zenye wanakuraga, kama kujidunga, kama kukura hizi majani zenye wanakula, lakini although wao wanasemaga hizo mavitu zao zinawasaidia, lakini hakuna nguvu yenye wanakuaga naye isipokuwa kuwa tu kujiwaste.
What do you have to say?
I agree with the alcohol.
Yeah?
I agree with the alcohol and the majani, assuming I figured out which majani she was talking about.
Yes.
Yeah. Yeah, so it is true that alcohol and drugs of abuse will cause a bit of infertility, either through teratogenicity, especially smoking, can adversely affect the sperm quality and the egg quality if it's a female taking the issues. But of the others, we may need to sit down and discuss further.
Yes, because now, anasema, hi, I had an ectopic pregnancy. What next should I plan to be, or when next should I plan to be pregnant? Let's first talk about the ectopic pregnancy.
I knew you were going there. An ectopic pregnancy is a pregnancy that is outside the uterus, so it can be the tube, ovary, wherever it is. They're more common now than they were before. According to me, it's because of the use of P2. Most people use P2 as a form of contraception, and yet it's an emergency pill. So all it does, it tries to stop pregnancy from happening. So especially if you take it after the 24-hour mark, then if the pregnancy had formed and was moving into the uterus, it will just be stopped at the tubes. So
okay. Now let's get into the other part. Ameuliza kwanza. So after how long should she plan?
3 months.
3 months. Perfect. Okay. Now let's get to the other topic of infertility. So what is infertility?
Sit down. So infertility is when a man and woman have been trying to conceive, but the sperm count is not enough. So the sperm count is not enough. So the sperm count is not enough. So the egg quality is not enough. So the egg quality is not enough. So the sperm count is not enough. So the egg quality is not enough. So the sperm count is not enough. So the egg quality is not enough. So the sperm count is not enough. So the egg quality is not enough. So the sperm count is not enough. So the egg quality is not enough. So the sperm count is not enough. So the egg quality 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 is not enough. So the eg when they have regular intercourse every month for 12 months and it's not successful, that is below the age of 35. After 35, we give leeway for 6 months.
Okay.
Yeah. So it has a couple of issues that bring it up, and I'm sure you're going to ask me which ones, but it is usually 30% female factors, 30% male factors, 30% combined. Wife has a few issues, husband has a few issues, and then 10% we don't know. We've looked for everything, we can't find an actual cause. We call it unexplained infertility.
Okay.
Yeah.
And apart from the fact that you can't be pregnant or conceive rather, is there another way of diagnosing infertility?
No.
Okay.
I think we can only know once you have tried for 1 year and you're not successful.
Yeah.
But if you have tried and you've gotten miscarriages, that's not infertility. That's recurrent pregnancy loss.
Okay.
And we get so many people telling us, oh, I have tried, I keep losing, so I'm dealing with infertility. Not really. Okay. Then there's what we call primary and secondary infertility. Primary means this lady and this man have never conceived ever.
Yeah.
Okay? Whether outside in other marriages or wherever they have been, they've never conceived. Secondary means there's a baby, but after getting that particular child, they have been unable to get any other child after that. So that is secondary infertility.
Okay. What causes the secondary infertility?
Multiple factors. It could be that they got an infection after the fact that blocked their tubes. It could be that they bled too much during delivery. It affected their hormonal balance, unable to conceive afterwards. But most of the time for secondary infertility or age, like now they'll be above 30, above 30 years or 35, and then the egg quality is just not good or the sperm quality is just not good.
Okay. For the women, you've said it's 30% the ladies, 30% the men, and then 30% combined. So mostly for the ladies, what is the major or the most commonest cause of infertility?
It depends on the age group, really. But whenever you're thinking about infertility in women, I think last time I tried to mention, it depends on where. So we check the ovary. Is it a hormonal issue or is there a problem with the egg quality? Is it a tubal issue? Usually it will be a tubal issue in our population after 30. I don't know why. I think maybe because of being predisposed to infections. So is it a tubal issue? Is it a uterine issue? Do they have fibroids that are blocking their way? Do they have endometrial issues? Is it endometriosis to begin with? Then at the cervix, is the cervix blocked? Or did it go through a procedure? Let's say you had issues of cervical changes, like going into cancer, so you got a conization or something was cut from there. So could it be that it healed and blocked the root, you know? Or is it a vaginal issue?
All right. For the men?
Same thing. Is it a testicular issue? Okay, because that's where production happens. Is it the tubes that are going from the sperm to the penis? Is it that the semen quality is not good? Semen is what gives nutrition to the sperms. So is it that the semen quality is not good? Is it that at the point of the penis, is it pointing the right direction? Are they ejaculating backwards? So,
I see a question here, and she's asking, what causes ovarian cyst? And nimeuliza kwa sababu ninaona mwingine pia ameuliza, does ovarian cyst cause infertility?
It can.
Okay.
Yeah, it can. To answer, ovarian cysts are of different kinds. They're physiological and they're pathological. So the physiological ones are the normal ones. The ones you ovulate and then it comes, it goes away, it comes. That one is very normal. The pathological ones, what they do, a cyst means there's a bag with water. So if this bag has blood, for example, in endometriosis, it makes the egg quality around it bad. You see how that would cause infertility. Assuming the cyst grows big and stretches the ovary. As it's stretching the ovary, it also worsens the quality of the eggs. Okay. If it's polycystic ovarian syndrome, that is now a hormonal issue, that the hormones are unable to allow the eggs to mature conclusively. So again, depends on the type, but it can cause infertility, true, and it is treatable.
All right. What are the treatment options for infertility?
Surgery. If it's a cyst for infertility, medications. Yes.
Okay. So, you
so
have
we
to
check we check what the issue is. If it's for the lady, we check if it's a tube. Then we know, are we going to try to open up the tubes? We call that a tuboplasty. If it's a cyst, are we going to remove the cyst? If it's polycystic, are we going to give you medications to try and trigger the eggs to grow, to be released? If it's a uterine issue, are we going to remove the fibroids if they're fibroids? If remember the transverse septum that we asked about. So are we just going to remove the septum? You get, so it depends on what we are treating. If it's a cervical issue, do we need to dilate it so that it can allow sperm to go through? Yes.
All right. So what are some of the lifestyle causes that would cause infertility? Maybe what we eat, how we live. Is there something in lifestyle that would cause infertility?
Yes.
Which is?
Smoking.
Yeah.
Smoking, drinking. Would you believe this? Being underweight. Less than 50 kilos.
Well,
So underweight, overweight as well, both of which they play with how your hormones behave, and that blocks in fertility. Yeah, so healthy diet is really important when you're trying to conceive. There are fruits, there are foods that are very good for fertility. I think we'll mention at some point.
Can you just mention them? Like?
Okay, beans. Beans, imagine. Black sesame seeds, I don't know where you get them in Kenya, but they're there. Turmeric.
Turmeric.
Imagine, I don't know why, but it works.
Okay.
It works. Yeah. There's bananas. There's salmon, as I was mentioning earlier. Salmon is very, very good. There's egg yolk.
Egg yolk. Okay. So you can just as well eat eggs.
You can just eat eggs, but don't fry them. You kill the yolk. So just either boil and take the yolk, or you just, if you can, if you have the energy for it. If you have the energy for it. But we also have traditional foods that people know are good for fertility. Is this mugombero? Have I said that right? Mugombero. Something like that. It's a Luya meal, but it's also very good for fertility.
Okay. And
spinach.
And spinach. Spinach.
It has very good folate.
Okay.
Yes.
Wow. Anasema, hello. Please, I need to know the treatment for ovarian cysts. You've got that 7 years.
I need to know the cyst, to be able to treat it. Yes.
Okay.
Yes.
You'll be giving your number as we wind up pale mwisho, so that anyone who needs to talk to you would talk to you. Anasema anaitwa Priscilla kutoka Kirinyaga. Mimi humwa na side moja ya tumbo nikiwa na periods, na sasa uchungu inaendelea hata kuinama ni shida. What would be the problem?
One-sided pelvic pain during periods. I would be interested to know how painful are these periods. I'd be interested to know if when she has coitus it is painful, and rule out things like endometriosis or a pelvic cyst on that side, or a prior abscess. An abscess is an infection that coalesced into like a mass. So I'd want to know what is on that side of the pelvis.
Okay. So we'll give you a number. You can call that number, and then she will be talking to you. Anasema, hello daktari. Now this is very interesting. And can stress cause infertility?
Yes, stress can cause infertility. Again, whenever you're stressed, your body goes into fight-flight mode. There's another one, but I've forgotten it. But fight-flight is the most important. So when you're in fight-flight mode, remember, primarily, we're trying to protect ourselves as human beings innately. So when you go to fight-flight, everything is shunted towards that direction, that you're in survival mode. So when you're in survival mode, then it becomes very difficult for you to conceive. Why? If you're pregnant, are you going to be able to fight for yourself? No. Are you going to run for yourself? No. So the hormones of fight-flight are those cortisol, adrenaline, or adrenaline. They go to the brain and block the hormones that are responsible for fertility. Okay. Yes. Wow. It's actually one of the reasons, if you're one of my patients for fertility, I usually tell you, avoid stress. Actually, nakwambianga mimba haitakangi stress. Mimba haitaki pressure. Haitaki daktari alisema ni leo. Haitaki pressure. Okay. So don't keep thinking about it, stress yourself over it. Yes. And you know, the 10th of this month, last week, it was Mental Health Awareness Day. Yes. And tumetoka kuiongelea hapa sai. Tukasema mental health is very vital for everything. For you to survive, for you to be okay, literally, you need to first take care of your mental health. Yes. Sawa sawa. Let's talk about PCOS. Yes. Let's start with, what is PCOS? Okay. Polycystic ovarian syndrome. That is what PCOS stands for. It is a syndrome where your ovary, due to hormonal imbalances, is unable to ovulate normally. It also grows bigger than normal because the hormones that are responsible for ovulating are not responsive enough. Therefore, there are very many tiny follicles that didn't ovulate, so they keep stretching. And as they keep stretching, the second role of the ovary is to produce hormones. So they keep producing hormones. And those particular hormones also keep telling the body we don't need another baby. So it's a very bad cyclic issue. So these hormones that they produce are a type of estrogen that converts to testosterone, which is the male type hormone, but now in larger quantities. So you end up seeing people with extra hair on their face, extra hair on their chest, their beard growing. Then two, the body now stops responding to insulin. Remember I was telling you earlier about insulin? So it stops responding to insulin. As it stops responding to insulin, you get more central obesity, or rather fat around your tummy. That fat around the tummy goes back to the brain to tell it, no, these hormones we need more of. Then it goes back, and then it's a vicious cycle. Very vicious cycle. So what we do is we try and rebalance the hormones so that you're able to now stop having the excessive hair. You have the right quantity of estrogen and progesterone. And then with that, you're able to now get your menses correctly. Then once you've gotten your menses correctly, when you're ready to conceive, now we switch to helping you to conceive.
All right. Wow. Let's get to see about, we'll be coming back to PCOS because I've seen a couple of questions about the same. But before we do that, let's get the myth busters so that we can see what are some of the myths that are related to infertility. You've mentioned this, that being overweight and underweight doesn't affect infertility.
It does.
It does.
Very much so.
So check your, is it the BMI?
Yes.
Yeah.
Yes.
So check your BMI and make sure iko sawa.
Okay. Within normal.
Iko within normal. So infertility is primarily a female problem. Is it?
No. 30%. We have 30%. Another 70.
So you get to see where the 70% is falling under.
Yes.
And as you say, the 70% would be
30% men, 30% men and women together. Like one couple has some issues and the other has some issues. And then 10% we just don't know.
Okay. So 10% is for fully prayers. Anasema, hi, mimi nimekaa na mtoto kwa tumbo. Okay. So the baby died akiwa kwa tumbo. Okay. Na nasema bado yuko hapo, although alikuwa experience the menses, but imefika mahali ikatulia.
Okay. So her question is, do we remove? What is her question?
What happens?
Okay. If your baby has died in the womb, then that pregnancy is not viable. So ideally it needs to come out, whether we deliver the pregnancy or whether we induce for the miscarriage to happen, because what happens is that it alters the body's mechanisms, and then 2, it can cause an infection, and that infection can cause you not to conceive again. So it's very important for them to actually come and have the pregnancy cleared out of the body.
Okay. What causes that?
Baby dying in the womb is a type of miscarriage. So in that type of miscarriage, either they didn't get enough blood, or they didn't get enough nutrients, or the body attacked the pregnancy. We cannot know at what point the miscarriage happened and why, but most often it would be that the body of the mom attacked the pregnancy, or that it had what we call congenital issues, or chromosomal abnormalities, and therefore it is not a viable pregnancy. The baby was not compatible with life, and then they died in the womb. Yes.
So can that be avoided?
Yes, if it is recurrent, then we need the medications we give. First, the tests we do to find out why is that happening.
Okay.
Is it that your body is attacking the pregnancy? If it is, then we know the medications to give you. Is it a thyroid issue? Then we know to control the thyroid. Is it a diabetes issue? We control the diabetes. So we need to find out what's going on in the mom. Then now we can protect further.
Okay.
But the one that has died, unfortunately, there's not much we can do.
Okay. So sorry about that, but please go get checked. Sawa sawa. Kuna mwenye muuliza about ovarian cysts, mwenye alikuwa 37 years old, and uliza what are the medications. Please, we'll give the number. You've said it's very important for them to get checked first.
Yes.
So you need to get checked. Do I know what kind of ovarian cyst? What doc should do about it? So please contact daktari. It's very important for you to work with the doctor. Okay? Anasema, hey Rachel, hey, please ask the doctor what causes miscarriages in the first trimester.
Okay, I've just answered.
Yeah.
But mainly would be chromosomal abnormalities, which means as the pregnancy is starting to form, that the genes from mom and genes from dad did not match correctly, or did not blend correctly. Usually we say, take this from mom, take this to dad, from dad, and then 11 from mom and 11 from dad come and meet, intersect, and then join to get a new baby who has part mom, part dad. So if this joining did not happen correctly, then the body now starts checking, is whatever has been formed compatible with life? If it's not compatible with life, then you end up having a miscarriage, unfortunately. So 60% of miscarriages would be because of chromosomal abnormalities. But other factors would be your body attacking the pregnancy, an immunological factor, or it could be that they had hormonal imbalances, as I was mentioning, with thyroid and diabetes. So that's something else that can be a problem. So again, we check what happened, but the commonest is bleeding. If you notice a bleed, and the baby is still alive, that's a pregnancy we can save, because we can stop the bleeding. Because if during implantation there was a bleed because the baby implanted on a big artery, then we can relax the uterus, allow the uterus to form a clot, and that place to heal, so that the pregnancy continues. So at least if you start noticing bleeding or brownish black discharge, we need to halt, go to hospital, protect the pregnancy. Yes.
Anasema, we have so many questions. I think we'll just give a number we'll give you a number because I see we have so many questions. Let me see. We can ask 2 because time is not together with us. We'll just ask 2. We'll answer 2 questions. Alafu tumalizie hapo. Asema, hey Rachel, hi. Please ask Daktari, why is my abdomen on the left side in a fora and it's painful? It comes and goes. Again, I'm having abdominal cramps na sio periods or pregnancy. Hadi ninashindwa kuketi ama kutembea.
Are they constipated? That would be, okay, my first thought on that one is constipation because it's the left side. It could be that the colon on that side is packed. And remember, okay, you may not know, but when we go through the gut, it comes from the right going towards the left and then it exits.
Okay.
So if everything is on the left side, they need to tell me how is the diet and how often do they pass gas, how often do they pass stool, is it painful, does it have a foul smell? So I think I would just suggest to go to hospital and have it seen, because if you have constipation or if the colon is packed, you'll have crampiness based on the body is trying to push this thing to get out.
All right.
Yeah.
Anasema, good morning. Okay, Anasema, good morning. I have a very painful ovulation. It does feel like I'm giving birth during ovulation. What could be the problem?
Okay. Ovulation during ovulation, it means that the egg is bursting out.
Yeah.
To go to the abdomen, and then the tube does this and picks it back into the tube, and it goes to the uterus.
Okay.
So that process actually rips out part of the ovary. It's a small part because the egg is also small, but for some people they will pick that pain. It's called multi-tremors. The way to go about it, that is why it is painful, the way to go about it, unfortunately, is painkillers, or we stop ovulation altogether. We have contraception for the time frame that they don't want to conceive, and then once they're ready to conceive, we remove the contraceptive.
Okay. Last question. Sema, good morning. My daughter is normally experiencing a lot of pain on her left during menses, and they're very heavy. She's always very cold in her feet and legs. What would be the reason? Hata nimefunga.
Painful periods are not normal. They could be something we call primary dysmenorrhea, which means we look for any other cause. It's not endometriosis, it's not a cervical issue. It's just the prostaglandins are released at a very severe pain. Prostaglandins are those pain signals I was talking about. So when something is happening in your body, you get a pain signal. So especially for adolescents, the cervix is not yet it's still tight. It's still very tight. So whenever you're getting your periods, the uterus contracts up and down to push the blood out, and then the cervix opens a bit to allow the allow the blood to come out. So that opening a bit releases prostaglandins, pain signals that can go to the brain, and then will be, depending on how the baby, adolescent is, they can be very painful. Okay. Especially when they ovulate, because it has primed the body that we can get pregnant. So for that is actually primary dysmenorrhea. For that, the medication again is pregnancy. That's why you'll be told, ukisha deliver, utaacha kusikia uchungu. Why? When you get pregnant, during delivery, the cervix opens up to 10. Then it closes back. So when it closes back, it doesn't close to a tight, the way it is before you deliver. So there's always like a space. So you'll find someone had a lot of pain before they got pregnant, and then afterwards it was okay. I am not telling adolescents to get pregnant, please. We have painkillers that we can give to allow the process to be better. We have meditation that we take them through to allow them also to kind of process the pain.
Okay.
Also, they're very responsive to their body hormones. Okay. So, for example, if they're stressed in that month, for example, they have exams.
Yeah.
In an exam period, it is not uncommon for the period to be bad enough for them to even collapse. Why? Because they're very responsive to the stress hormones, and then now you've added periods. If that happens, please go to hospital, have your gyna check you, have your gyna work with you.
Yeah.
We can diagnose things like endometriosis as young as even below 16. Okay? So it's important that we have ruled all that out before we say this is primary dysmenorrhea.
Okay. Okay, perfect. Now, what is the number that people can call for them to, because I see we have so many questions on our Facebook page, kwa namba zote mpaka sasa inbox. Like, we don't have time. But I know they can always reach you. You have an office in Nakuru. Let's start with that.
Yes, I do have my office in Nakuru. It's at CK Patel Building, 9th floor. The hospital is Wheels for Life Healthcare.
Yeah.
Yeah.
Kuna lift.
Kuna lift.
Yeah.
Kuna lift ina work every time.
Yeah.
Na generator. But tulisema watu wachukue stairs.
Okay,
Yeah.
strong point.
Strong point.
Yeah.
But CK Patel, 9th floor. We are there every single day, even Saturday, but 8 to 1 p.m. on Saturday. The rest of the day is 8 to 5, 6 p.m., depending on the patients. I'm available online in case you're not in Nakuru. We have an app. It is called Wheels for Life. It is available on Play Store. I think by next week we should have it on Apple. You can book an appointment, or you can reach us on 07 19 11 66 11.
Perfect. It's on your screens. So make sure you call. Yeah, all those questions, she'll respond. I know, she will respond, yes. Hata kama uta drop to a text, she'll make sure she responds to you. But also, the other time you told us there's a number that people can call when they are
Pregnant in an emergency.
In an emergency to get free transport. Yes. Does that apply across the country? Across the country.
There are counties where we may not be able to, but we'll try and liaise and see. But yes, we do have it. It's 1196.
1196.
It's toll free.
Toll free.
Free everything.
Okay.
So free transport, free consultation, and free consultation.
Free calls.
Yeah, free calls.
Okay.
Yeah.
So that's 1196.
1196. Yeah, and thank you, Telesky, for making sure it remains open. Thank you.
God bless you. So 1196. Save that number on your phone. It's very important. Hata kama sio wewe, you might be of help to someone else, which God will bless you for that. So make sure you save that number, 1196. Okay? So asante sana Doc for coming.
Thank you for having me.
A wholesome conversation. And I know that it has helped people out there. Yes, it has impacted people. So now that you have that information, it's up to you to make sure that you get checked, because it's very, very possible for you to get a baby, to get babies, if you follow everything vile inatakana kukua. So you can always call her. She will be there for you. Ata make sure kila kitu iko sawa. All right? So for now, we'll be getting the health tips. Yes, the healthy living. Yes, healthy living. And today's iko tu hapo kwa infertility and pregnancy as well, so that it will help you and keep reminding you that you need to take care of your body, you need to take care of yourself, and you shouldn't blame anyone. It is very possible for you to take care of everything. This is a very, very, I'm very skeptical when talking about infertility and pregnancy, because I've had so many questions about it. People have really opened up about the same, and there's the stigma part of it, which is really sad. Yes. Really, really, really sad, because we've said that it is not only ladies. It's 30% the lady, 30% the male, 30% combined, and 10% yenye tunaachia Mungu. Okay? So the stigma is very uncalled for. Sawa sawa. So chatumalizi hapo, because you might end up taking a lot of time. God bless you. God be with you. God bless you for coming. We do really appreciate.
Thank you. Once again. All glory and honor to God.
Yes, tukikuhitaji tena si utakuja.
Kama kawa.
Perfecto. Healthy living, wacha tuone tunapata nini leo.
Hello and welcome to Healthy Living. My name is Sylvia Wanja. Today, we are going to focus on the don'ts of pregnant women. Number 1, don't engage in hazardous physical activities. Avoid activities that pose a risk of falling, injury or trauma to the abdomen, such as contact sports, e.g. football, basketball, skiing, horseback riding, and extreme sports. Number 2, also, avoid heavy lifting. Lifting objects can strain your back and potentially lead to injury or early labor. Be mindful of how much you carry and always use proper lifting techniques. Number 2, don't take over-the-counter medication without consulting a doctor. Many over-the-counter medications, including pain relievers like ibuprofen and aspirin, can be harmful during pregnancy. Always consult your healthcare provider before taking any medication, including herbal supplements and vitamins. Number 3, don't skip prenatal appointments. Regular prenatal care is essential to monitor both the mother's and baby's health. Skipping appointments can lead to missed opportunities to address potential complications early. Number 4, don't expose yourself to harmful chemicals. Stay away from harsh chemicals such as pesticides, paint fumes, and certain cleaning products. Exposure to these chemicals can increase the risk of birth defects and pregnancy complications. Opt for natural or less toxic alternatives. Hair dyes, tanning beds, and certain cosmetics may contain chemicals that are harmful during pregnancy as well. It's best to avoid these treatments or consult your doctor about safe options. Following these don'ts during pregnancy helps ensure the health and well-being of both the mother and baby. Always consult with your healthcare provider about any concerns or uncertainties you have throughout your pregnancy. Avoid risky behaviors and practicing healthy habits can promote a safe and healthy pregnancy. Hello and welcome to Healthy Habits Can Promote a Safe and Healthy Pregnancy.
Such a wholesome conversation, and I know that you've gotten something from that. It was very important for all of us to get to understand everything about pregnancies, about fertility, just to make sure that hakuna mtu anakuwa na complications hapa na pale. And during the healthy living, Sylvia Wanja amewaambia that missing appointments with your doctor might lead to you having missed a complication or something that would end up to you, unfortunately, very unfortunately, losing the baby or having a baby who's having complications. So make sure you see your gyna, and tumesema ni 3 months before you even get pregnant. So if you're planning to get a baby, this is the best time for you to go see your gyna, because the things that you have to now start doing, there's a lifestyle you have to start living because you're now preparing to carry a baby. Sawa sawa. So that has been it on today's discussion with Dr. Jemima. Na amewambia unaweza enda pale CK Patel 9th floor and you'll be able to get the consultation from her. Sawa sawa. So for now, let's get the myth buster. Tuone what we are getting today. Unajua macho siku hizi anatutengenezeanga tu vitu hapa na pale. No, the did you know? Yes, the did you know. So let's get the did you know. We see what we are getting today on the did you know. So inasema that the average human body carries about 1 to 2 kilograms of bacteria. Did you know that? Did you know that? Is it true though? Yes, that an average human body carries 1 to 2 kgs of bacteria, but there are positive. There are bacteria which ziko tu sawa zikikuwa kwa mwili. I hope I'm right, doc. Yes, so there are bacteria that ziko tu sawa zikikuwa kwa mwili. So ziko included kwa hiyo 1 to 2 kgs of bacteria. Okay? So that is it on Did You Know today. Do we have the tips ready, Mwelekezi? Because we need to understand and to see what we have gotten from today's discussion. We've had an amazing, a wholesome discussion. Okay, so in a very few minutes we'll be getting to see what we have learned, but you can always talk to us through our number 0721105105 23814. Of course, we're live on Facebook, we're live on YouTube. Ukienda pale pia tuambie, from the discussion that we've had, what have you learned today? Just one or two things. What have you learned today? Because we can't have such an amazing discussion and then you just go home without getting a take home for you. So what has been your take home on today's discussion? But before we get there, let's get to today's inspiration, because it's very important for you to get inspired. Are learned during the worst days of your life. Whoa, okay. So get up and see what's new, what new learning you had on a bad day. Okay, this is a very sad reality that the best things are learned during the worst days of your life. So get up and see what new learning you had on a bad day. Yep, so what are the things that you learned during the bad days? Because the very important learnings, you do them during the worst days. In fact, on Monday, yes, on Monday, mlikuwa hapa mnafanya Bible exposition with the one Jimmy Ningwa, and you had Reverend Musambai here. Now, after that discussion, alikuwa anatuambia that he really does appreciate negative criticism. That positive ziko tu sawa, but you see the negative ones, hapo ndio unalana mambo in this life. So the negative ones are already very, very important for you. Although ndo zatupendi sana, but they're very important because you get to learn about yourself. You get to learn what you're doing right, you get to learn what you're doing wrong. And during the bad days as well, you get to learn what are you doing wrong? What would you have done right on the bad day to make it a good day? And then you will implement it and you won't have bad days again. Sawa sawa? So that's today's inspiration we get today, of course, on a beautiful Wednesday like this. Now, we're getting into some of the tips that you've gotten, and this is what you guys have said that you've learned. I'll start with the very first one that says that infertility can be caused by various factors such as age, the quality of the egg and the semen, uterine abnormalities, and hormonal imbalance. Yes, hizo zote zinaweza zika cause infertility. So ukiona mtu ana struggle na infertility, it's not for you to start saying ati hapana wewe hata you are cursed. You know all those things that people say out there. That's not the reason. Tumesema 30% men, 30% ladies, 30% pamoja, and then 10% tunachia Mungu. So hiyo ya Mungu isikuwe ni yako ya kujudge. Sawa sawa. And then that preconception care is critical for couples in order to optimize health and reduce risks associated with pregnancy. Sawa sawa, so make sure you go to your gyna for the preconception care. The other one is that prenatal and postnatal care is essential in ensuring the well-being of both the mother and the baby. And that persistent headaches is a major sign of complication in the pregnancy. Na hii ndio wengi wenu, watu wengi wanachanga tu wako like, it's just a headache. I'll just take paracetamol each and every time and I will be okay. Persistent headaches, and go get checked by your gyna, all right? Because it is a major sign of complications in pregnancy. The other part is that other pregnancy complications include hypertension, thyroid, and diabetes. Yep. So with your gyna, of course, you'll get more of an explanation to that and what you're supposed to do in regards to the same. And this is the last one ambayo tumeisoma hapa, that infertility can be caused by various factors such as the age, egg and semen quality, and uterine abnormalities. So that is it for today. I hope that you've gotten something as well. Siku umeenda tu and you've not learned something. All right, so that is your take home. And what I would say to all of you is that make sure you go see your gyna. If you're planning to get pregnant, it's very important for you to start your preconception care with your gyna. It will help. It will take care of your baby. It will make sure that you as a mom, you are safe as well. Sawa sawa. So that has been it. We've had this discussion with Dr. Jemima. Now we're going to be seeing you next week on another amazing conversation on health. And kama kawaida, if you have something you'd want us to talk about, please reach out through our number 0721105105 on WhatsApp 23814, our SMS code, which is absolutely free of charge. Sawa sawa. Also, we've had the number. We'll be getting them on the screens as well. The number ya daktari. So you can call that number if you have any issue you're going through. If you're pregnant na unaona kuna blood spots, hiyo inakwambia there is danger. So call her. If you're having any complication, if you're having headaches, if you're feeling ni kama kumekuwa na fetal movements but sasa hakuna, make sure you go get checked. It's very, very important. All right. So God bless you. God be with you. Thank you so much for tuning in. My name is Kahogo. I'll be seeing you on Friday. Now on Friday, we are having a session with the Richards, Maggie Richard. And Maggie Richard will be coming with her team. It will be an amazing session. Of course, unajua on Fridays inakuanga ni siku ambayo we just come here, we praise, tunajibamba. So make sure you don't miss out. It's going to be really amazing. Sawa sawa. So God bless you. God be with you. Now we'll be getting some music as we wind up. We'll be seeing you on Friday and of course next week on Wednesday. But until then, have an amazing rest of the day. Bye-bye.